upload it to our YouTube channel and send it out to all the staff through OnShift, the link, so they'll be able to access it. So please don't mind the cameras, but that's the reason for it. So are we all good? Okay. So I'm just gonna kick us off for a few minutes and just say a couple of remarks. I wanted to first introduce our medical director, Dr. Balaji, and hopefully, my name is Ann Kahn. I'm the president and CEO of McGregor. And I just wanna take a few minutes to reflect on why we're here today. I think for many of us, this is the first time in our lifetime where our personal choices have a direct impact on the health of our families, neighbors, teammates, and residents. In just a few minutes, you'll hear from our medical director, Dr. Balaji, who will answer your questions about the vaccine. While there are unknowns about the long-term effects of the vaccine, we do know the effects of having COVID. We know that the virus can damage our lungs, heart, and brain, which increases the risk of long-term health problems. We know that the virus can kill older adults and sometimes younger individuals who have no underlying conditions. Because COVID has killed so many seniors in nursing homes across the country, we have the opportunity to receive the vaccine first, along with hospital workers and first responders. This is the first step towards protecting yourself, your families, and your friends from contracting a disease where we don't know the outcome. So I'm asking everyone to seriously consider taking the vaccine. You know, each one of us will make that decision for different choices, different reasons. I'm choosing to take the vaccine because I want to hug my mom and dad again. And I want our residents to be able to do the same. So I just wanted to share that personal reason as to why we're taking this extra effort to answer questions. We realize there's a lot of, misinformation, as well as hesitancy around the speed of the vaccine development. And there's a lot of reasons why there was the need for the fast development, but I wanted to just start with that. So on that point, I'd like to turn it over to Dr. Balaji.
Thank you. Thank you. I think Anne summarized it very well, why we are here and why we should, consider taking the vaccine. I'll probably summarize because it'll be much more valuable if it is a question-answer session. But I'll summarize the couple of things that Anne pointed out. One, the vaccine was rushed, and I'll try to address why it was rushed, or why it seems like it was rushed, and what are the problems that may happen with the vaccine, which is still a gray area, but we'll try to address to the best of our knowledge. So to the first point, and which is in everybody's mind, was this vaccine rushed? From the point that we first found out about COVID-19 to market, this vaccine is probably the fastest ever developed. But there are some inherent things that happen to bring it to the market that fast. One of the things we probably all remember, the SARS was there in 2016, 2018 time, when already research was in place for a vaccine, but thankfully that did not pan out to be as bad as they thought it was going to be. So that research was already in the shelf, which they could tap on to use for this one. The second big one was the genome sequencing of the virus happened so fast. Like within a couple of months, they had sequenced the virus, which was critical to develop this vaccine, because this is unlike other vaccines, which we'll talk about during our question-answer session. This was a mRNA vaccine where the genome was so important, and that was sequenced very fast because of the technology, and that was available to make this vaccine faster. So I think those two factors were very valuable to get the vaccine in so fast. In fact, the conventional vaccines that we all know of like the chickenpox vaccine or the polio vaccine. Such vaccines are still in development. They're not out because they do take longer compared to this, high-tech vaccine that we have currently. That's to the point about Anne raised. Is it rushed? Probably not, but there was also the rush to get into market, rightfully so, when millions are affected and thousands are dying. The other part, will the vaccine have problems down the road? This vaccine, unlike the vaccines that we know of, it does not have a component of the virus in it. It's only the genetic sequence of the virus that's replicated in that RNA. Other vaccines had either the live virus or the killed virus in the vaccine. That gave certain problems down the road. But having said that, we don't know that completely. But when you weigh the benefits and risks, meaning the risk of contracting this disease and not knowing what it can do, because there are consequences we are still learning that it can do. Even people who went through the immediate infectious phase, 6 months out, still have symptoms and problems from it. So when you weigh the risk and the benefit, I think it weighs more in favor of the vaccine. So, I will stop right here because most of this vaccine, we have all read it either in the press or watched it on TV. So I'll stop right here. I'll take questions.
Don't be shy. I know you're not.
How many times do you have to get it? Is it only one time or twice, or, cause we don't hear rumors?
Yeah, very, very good question. Like currently, we have the first vaccine dose and the second dose in 21 days for the Pfizer vaccine. For the Moderna vaccine, when it comes out to the market, it'll be day 1 and day 28. So this is 3 weeks and that is 4 weeks. But how long will that last? Would we need another booster a year from now? We don't yet know that. Yes, please.
So, I know they were saying that United Kingdom took the vaccine. I haven't heard too much on any type of results or anything. Are they?
United Kingdom, huh? Just for the benefit of the camera, I'm going to repeat that question. So, for the people who got it in the United Kingdom, were there any problems? It's only probably about a week to 10 days since they started to get it. The one thing that came out of that, there were 2 patients who had multiple allergies, who had allergic reactions from the vaccine that had them stay in the hospital overnight, but they did very well. But both those patients were people who had allergies to multiple agents. So what I think is it is probably not the vaccine that was the problem. They probably had an allergic state to substances, several substances. So it was probably not the vaccine, but they have that allergic state. And FDA after that has issued a warning saying anybody with severe allergies should not take it until we have more data. But they did not define what that is. They have left it to our, we have to make a personal decision on that. Yes, please.
Dr. Palagi, the form that we're filling out from CVS does say if you have food allergies. And I'm anaphylactic to shellfish, so I'm a little leery. I wanna take it, but will I be okay?
If anybody has multiple allergies, let's say they have allergy to food, they have allergy to medications, and they have allergy to environmental agents like dust. You know, if they have that kind of allergy to more than 2 substances, I think they should wait. They should wait to see what the data comes out. We probably all saw a nurse who was given the vaccine who had that episode, but thankfully she did well. That was not an allergy. It was more like a syncope. Yes, please.
We've heard about the, virus mutating in England, and I'm wondering that, if we take it here, has it started to mutate here? And if it has, will this protect us as well?
You know, that's a very good question, very relevant. Both Pfizer and Moderna say that the vaccine should be helpful in preventing that strain as well. But having said that, they are checking that out. They're checking. But that's only one of them. We have almost about 50,000 variants, you know, since the time it came out. There are different strains, and the technology is so great. We have genetic sequencing, the genome sequencing for all 50,000. And once somebody sequences it, they publish it to the internet. So people anywhere, you know, probably the researchers in that, you know, where people who do the vaccine, that's a small world. They probably know each other, you know. So they put it up in the internet, and somebody somewhere in Japan or Australia downloads that and starts to work on that. And that's how we got this out to the market that fast.
Yeah, that's the one thing, which I'm sure you're seeing on the news. This is the first time in history that the entire world has worked
Yes.
together on the medical. I mean, this is, when you talk about a real threat to every country, you know, this affects everyone. So that's why they were able to bring it so quickly, and governments, I hate to say, threw a ton of money at it, so they were able to bring it to market so quickly. So they weren't waiting to get the approval to start the actual manufacturing. They were manufacturing it. That's why they could ship on Monday after they got the approval on Sunday, which is we're really excited about, because otherwise we'd have to wait another 6 months to get the vaccine, because it would take them that long to ramp up the production.
That's so true, yes.
So I get the vaccine, but my spouse doesn't. So how does that help me? Like, that she can still get it, but then I'm not gonna get it.
You know, obviously the vaccine would have helped you, but you could still, being a healthcare worker, you could still be carrying it back home. So she still has the risk of catching it from you, even though you got the vaccine.
Oops, go ahead. Yes.
So the vaccine, it doesn't stop you from getting it, it just stops you from getting sick from it?
That's right. You could be a carrier for the virus, but you won't be infected by it. You won't have the symptoms. It won't be able to get into your body and give you the problems from the virus. But it could still be in your upper respiratory areas, and you may be transmitting it to others. And that's why it is vital, even after we all get it, to still wear the mask and do the PPE when we go to see our patients, because we don't know who's vaccinated and who's not. Yes, please.
So it's basically, if I'm getting the vaccine for my kids' purpose, it's pointless because my kids can't get the vaccine.
That's right.
So it's kind of pointless.
That's right. You know, you may still be carrying the virus. You still have to be careful in not infecting them. You know, let's say you go home, you would do exactly like you do now, you know, take a bath bath or whatever, you know, precautions you take, you would still do that even after the vaccine.
Yeah, I think the part that is, a little confusing at times is part of what, by taking the vaccine, we're taking ourselves out of that, kind of multiplier, right?
Yes.
So if we are vaccinated, and that's why we want so many people to take the vaccine, because that takes them out of the, healthcare system, right? So if, one of the reasons why, you know, when Dr. Balaji comes, every Tuesday, he shares about how many people are in the hospitals and how many people are being, you know, using ventilators and and you know, all of our staff here are tired. It's been a long 9 months, 10
Yeah.
months.
Yeah,
And so this is even though it still protects us, but it also takes us out of that multiplier, right?
Mhm.
So that I'm not gonna infect 20 people,
yeah,
right?
that's right, you're not in that chain anymore, yeah. And, you know, like, we have all heard stories, you know, of, people getting infected and having, you know, the symptoms from it. You know, as a doctor, I see up close, for example, like a 40-year-old man, he had this COVID, had fever, a little cough, sniffles, nothing major, you know, stayed home, was quarantining himself, working from home, but suddenly loses vision, because he had a clot in the eye. No other major symptoms, you know, so many others do well, and he has a clot in the eye. You know, they had to do surgery, but only half of it came back. So you hear all those horror stories. Another young nurse, the male nurse, he had his COVID in May. In September, he comes with a stroke. A healthy man does not even smoke, comes with a stroke. So you hear all those horror stories, and those are the things that we don't know about this virus. Is it going to be done in 6 months after you get it, or will you see consequences a year down the road, 2 years down the road? We don't know. And that's why when I said risk versus benefit, the risk of suffering the consequences versus taking the vaccine, seems like it helps to take the vaccine. And thankfully, we are all in healthcare, and we should thank the nation to have prioritized us, you know, versus the millions of people, you know, that we can get. And also, I think Erin can probably say that if we don't get it now, I don't think we have a second chance until everybody else gets it. Yeah.
That's true. What about the Moderna though?
Even if Moderna
So they're
comes,
not gonna come back like
No.
do Pfizer did Moderna or nothing?
you know, Moderna will still not come to McGregor. You know, they may have to go somewhere else because it's not enough of it available.
We've been making a lot of calls to families who, some of them think, oh good, they'll get a vaccine and now we can come and see them because they've been vaccinated. We have, families who are asking about other health conditions they may have. Say you have MS, you know, should you get the vaccination? And a lot of them don't want to be in the first group of people who get it. They wanna wait and see what happens to those people, and then maybe in the next round, but you're saying, you know, we don't know when the next round
would be.
might
Yeah.
be.
That's so true. We don't know. Because the next set of people who are going to get, we don't know, maybe it'll be teachers, you know, it may go to them. By the time it comes out to the public, that's probably when anybody else who's left out now would be able to join.
Now, in our dates that they showed us, it says, next week when we do the first, the January 19th and 20th, it says first and second.
Yeah,
So, is it possible that people who don't get it next week
yes,
could get their
first
first
one,
round
that's right,
in January?
yeah,
Yes.
yes.
Do we know if the and I'm asking for, Erin, cause she may know more detail, do we know if the residents are included in the second round as well?
Yes.
Okay.
Yeah,
Yeah, they're
because that's
included in
what some
all
of the
three
residents-
clinics. But if you don't get that first dose on the second round, there is no opportunity to get that first
Cause
dose
I know
on
it said the
third
third
clinic.
round is just second.
Just second, and then after, like Dr. Balaji said, once that third round
Then
or
we're gonna
clinic occurs,
Wait until.
we don't know when they'll be back. They are gonna move on to other industries.
I think the other part though, and we all know about, we're testing twice a week, we're wearing our PPE, we're doing everything we possibly can, screening employees. We still had 9 residents on the 3rd floor that got it. And not all of them are making it through that piece. So waiting 30 days is a personal choice for the residents, and their families. But I do think I don't want to sugarcoat that this disease impacts older adults significantly more than it impacts younger individuals. And so, I would hate to have someone say, well, I'll wait and see, and then they happen to be someone who catches it.
That's true, yes.
A couple of things that might help that I learned today on a CVS call was, those of you that are concerned about allergies, the pharmacist will have EpiPens available. They will be monitoring the staff for at least 15 minutes to 30 minutes. So know that is there. The facility will have something in place to monitor our residents, the ones that get it that day. So that might help some of you guys with, making those decisions. I'd also recommend too, if you have allergies, call your allergist, talk to your doctor about what they recommend based on your own personal allergies.
That's
So
right.
how would that work out if we work that day and get the vaccine, we still have to stay here 15, 30 minutes to be monitored, then go back to work, like, that'd be okay?
So, if you get mild reaction, fever, theoretically, I guess, you could get a fever from that, but then if you took your temperature out here and it showed that you have a fever, would you have to go home?
After the vaccine, to have temperature, myalgia, headaches, nausea, happens in 1 in 3 people. So amongst us, 1/3 of us may have it. But if a person has a fever, I don't think they would be able to pass through the front, if you check to have a fever.
No, if you get a fever as a result of getting the
Yeah. The vaccine, you still, wouldn't be able to work if you check with the fever.
Yeah, I think what we'll probably be looking at on a case-by-case basis. That's part of this is, it's very individualized, right? So you might get the vaccine, I get it, and you have no symptoms and my arm is sore, right? So it might be, everything's gonna be on a graded scale. Some people may have a headache and they take 2 Tylenol and they're fine and they go about their day. So in reading, they say that the booster shot is where most of the more significant, if you're gonna have significant side effects, that's where it comes.
Yeah,
So, it wouldn't be this January shot, it would be, or the December one would be in January.
anytime a new medication or, agent like this is rolled out, there is abundance of caution, rightfully so, but as we learn more, we may not be as cautious 6 months down the road when we know, what things are happening. For example, when the ACE inhibitors, the lisinopril and the ones that we commonly use now, when they were first introduced about 25, 30 years ago, they had to admit a patient to start the medication because they were so worried about hypotension that the blood pressures will go down. So those things happen, and for right reasons. You know, you want to be very cautious. You don't want anything going wrong. So some of what we are doing might be a little superfluous. You know, maybe you are doing more than what we need to do, but it's better that way.
So, would you recommend that younger adults, like, wait to take it, or would you recommend us taking it? Like, for the first round?
You mean younger adult to take it?
Yeah.
Yes, should take it.
You
Should
would
take it.
recommend younger adults too?
Younger adults too. Anybody over 18 should take it.
Okay, well, if you, cause I think you said if you had it before, then you would recommend us not taking it?
No, people who have, very good question, you know, people who have had COVID also should get it. They should take it because their antibodies are not going to come down with time. So they are at risk for a second infection. So they should also take it.
And what's the time frame, Dr. Balaji, that we have to wait when someone's had it?
You know, Pfizer or Moderna both have not specified that, but we know the antibodies last anywhere from 3 to 6 months for them. So they have time, at least another 3 months to decide.
So say that you want to take it during the second round. Do I have to let you guys know for the paperwork for CVS now, or so that you can have?
You meaning the second date? Yes,
The second
Erin will,
clinics?
yeah,
Yes.
she will.
So, on the call that I was on today too, they made it very clear that, like, no employee can just walk up the day of the clinic and say, I'd like to get the vaccine. I have to have all that stuff beforehand, so if you're planning it in this first clinic, I'm asked to get all that paperwork by tomorrow, because I have to upload it into a computer. With the holiday, it makes it a little bit more difficult. But, if you are waiting to do your first dose on the second clinic, we'll give a time frame again, and when I have to have that paperwork done. Cause the paperwork that I submit, that is the amount of doses that they're bringing, they're not bringing anything extra. So yeah, I do need to have that information ahead of time.
One thing we did find out yesterday is that, the state of Ohio did not receive as much vaccine as they were promised. And so they had an original plan where assisted living was also included in this first round, and they've now had to pull back and redistribute those doses to nursing facilities to make sure that, you know, that just kind of demonstrates the priority that the state is putting on our residents and staff to try to protect them. So and it's changing every day, unfortunately, but that's right off the presses.
Yeah.
I'm sorry,
Yeah.
I just wanna know, because they were saying Australia like scrapped the vaccine I think Australia maybe one of the countries scrapped the vaccine altogether because it was making people test positive for HIV. Did you hear about that?
No, I've not heard about that. I've not heard of any country scrapping it.
Yeah. they said-
And you mean after they get the vaccine, they tested positive for HIV?
Yeah.
No, I've not heard that. Yeah, and does not seem right to, because what is in the vaccine is only that mRNA, and that only codes for this virus, nothing else. So it's unlikely any other disease, you know, be it HIV or any other disease is not just unlikely, it's not possible.
Well, and even with this vaccine, you will not test positive for the vaccine.
Yeah,
Because there is no live virus in the vaccine,
that's true.
so.
Yes, sir.
Sorry to have to repeat the question, but I was asked the specific question by a staff member, who had, proven positive to, COVID within the past 2 months. After several weeks after another test, the test was negative, and then not long after that, the person returned to work. So should I tell this staff member that at this time they should not
you know, if they're like 2 months out from the infection time,
Yes.
and they're completely asymptomatic now,
Yes,
they
sir.
can go ahead and get it now.
Very good, thank you,
Yeah.
doctor.
One last question, Dr. Balaji. So you said there's no live COVID in the vaccine?
That's
So
right.
what is in it?
So, you know, very good question, thank you. Let's say the human body has a genetic makeup, the genome, yeah? So let's say if the genome is like a manual, you know, that's the DNA manual on how to do anything in your body is done through the DNA. The mRNA is just a snapshot of your whole body. We all have mRNAs, and the mRNA is just a one page of it, you copy it, you know, of that big manual. And that one page is to go say just that one thing. It might mean like recognizing light, tasting something, you know, it could be any one of those small functions that mRNA does. And that's all it can do. It cannot do anything else in the body, that one particular mRNA. This mRNA is a copy of the virus, genome of the virus, that think of it like a negative and a positive, like a picture, you know, the old formats when you had the black and white negative and the positive. It's like that. It takes a copy of that, goes into the body, and it can only do that, produce an antibody to this virus. And that's all is there in that vaccine. In that vaccine, those mRNAs are there. And for that mRNA is also a protein. So the virus, if you leave it here, in 3 days it dies because it's a protein as well, the virus. And the same way, if you left the mRNA, that will die too. So to protect it, there is some lipid structure around that mRNA. And that's why we freeze it, you know, so it stays stable. And that's all there is in that vaccine that goes in. There's no live vaccine in it. I mean virus in it.
Virus,
Yeah.
I was just wondering where it was derived from.
It's
Whether it's animal, vegetable, mineral?
it is synthesized. It is synthesized.
Okay.
Yeah. It is man-made, synthesized.
If you look at the information I sent out in the EUA form, it actually gives us the ingredients that's in the vaccine, that explains the synthesized.
Yeah. Yes.
Why is it that the Moderna one does not have to be frozen?
So that's another good question. It has to be frozen too, but not at the same level.
What
So
was the
the
difference?
so the mRNA is the same for both Pfizer and Moderna. The mRNA is the same, and that's why they both have that 95% effectivity. But they have to keep them stable. They have to package it with this lipid, which is like a fat molecule around it. That's different for Pfizer, and that's different for Moderna. So that is the reason why one is different from the other in amount of freezing. But they won't tell because that's their proprietary thing. That's patented information for them. So that's not public knowledge, what kind of lipid.
Well, I really appreciate you guys all coming. Thank you, Dr. Balaji, for
you.
taking the
Thank
time, answering questions. I think just to kind of reiterate a couple things that Aaron said, so if you are interested in taking this vaccine in the first round, we need you to pick up your forms. You can get them at the front desk, or you can ask, you know, Aaron or Darlene Rominski in the administrative office. She can get those for you. You need to fill them out and return them back by Wednesday, you know, Thursday at the latest, so that we can have them uploaded on Monday and have enough vaccine for whoever wants to get it on Tuesday.
Yes, and please attach a copy of your insurance card. That was something else that they said they need to have. If there's people in here that don't have insurance, there is a program
It's free, it's free, it's free.
Yeah, it's not gonna cost
It's
you
not gonna
anything.
cost you anything.
Yeah, but they'll build the insurance.
Yeah, we
But
did-
it won't cost anything out of pocket.
And for the folks that are on McGregor's plan, we've already cleared that with MMO. There will be no copay, no charge to any of the, employees for this vaccine. So we will cover that whole cost.
Thank you.
How many, what percentage of employees and residents haven't had taken the vaccine? And how long does it take for that percentage to reach what was called a herd immunity, where you don't have so much
You know, it will be 70% of the population,
of the.
United
of our
States.
nursing home?
No, to get a herd immunity, it has to be the whole country. In fact, it has to be the whole world in some ways.
70% of.
70%.
The
Yeah.
world's population.
Yeah. We are way, way, way away from that, yeah.
Yeah, but I think part of what, any step towards that is positive, because if you think about it, if there's no one for the individual that has the virus to infect, right, then the virus stops with them. That's why the whole contract tracing is so important. So if we, if someone in your family, let's say, contracts the disease, but everybody else around them has the vaccine and are not gonna be a carrier, it then stops there. So part of our challenge is, and why when you look at what the, number of people that are getting it, it looks like this, right? The curve of how many people have been infected. Part of that is because one person, let's say they infect 2 people, those 2 people infect 2 more people, so the spread is so fast. So the more we can put kind of, blocks in front of those people that are trying to spread, the better off as a country, as a world will be, because we're trying to do our part to stop it.
But if you get the vaccine, you can still spread it though, right? And you can still get it.
Yep. Right now, that's the thing, but let's say you have 10 people around you and all of them also are vaccinated, and the 10 people around them are also vaccinated. That's where, from what Ann says, your chances that you're gonna get are decreasing, but exponentially decreasing,
But it'll increase in the schools when the kids go back to schools because they can't get the vaccine. We are carriers, but it's like the kids are getting. So at that point, it's gonna keep.
you know,
I don't think the kids are really in the elementary or junior high, they're not the ones that get, your college kids, they're the ones that have probably had most of it, they probably
A
weren't
lot of
started.
daycares have had it. Little kids.
yeah,
have had it.
Yeah.
some of the children have had it. So, but the more of us, I know it's not an exact science. It's not going to stop them from getting it, you're right. But the more of us have it, the less the chances that they're going to get it, So it is not just for ourselves, it is for others too that we have to take it. So this is like truly in it together, unless all of us do it, it's not going to benefit a kid.
Well, again, thank you guys, I really appreciate, you coming and asking great questions. We're gonna then share this, like I said, with the rest of the team, the rest of McGregor that wasn't able to come. So they'll get to, hear what Dr. Balaji was able to share with us today, so, thanks everybody.
Thank you.
Thank you.
Ann.
Yeah.
Thank you very much. Thank you.